Hello learners, welcome to the certificate course on bariatric nutrition and health. And this course will be led by the instructor Brinda Rajkumari. So here we'll be discussing on the course contents, and this course contains totally 10 modules. In each part we'll be discussing like from the basics to the role of nutrition in the bariatric surgery. And in module 1, we'll be discussing on epidemiology in obesity. We'll just introduce the course initially, and then we'll define obesity, the global burden of obesity, disparities in obesity, which includes age, race, income level, and the level of education. And the next one will be epidemiology of childhood obesity and the trends in obesity. In module 2, we'll be discussing on pathophysiology of obesity. It includes energy balance in the body, energy balance and etiology of obesity, physiologic regulation and metabolic effects of leptin and adiponectin, appetite-inducing hormone renin, and the pathogenesis and etiology of obesity that includes environmental factors, the role of gene in causing the obesity, the food intake, and the physical activity. And in module 3, the basic considerations in bariatric surgery. In this module, we'll be discussing what are the basic requirements by the patient to do the bariatric surgery. It includes the mechanisms of action of the bariatric procedures, including malabsorption, caloric restriction, energy expenditure, changes in eating behavior, the indications for metabolic and bariatric surgery, the contraindications to metabolic and bariatric surgery, the preoperative care of the bariatric patient. That includes the criteria for the patient selection, cardiac evaluation, preoperative VTE evaluation, sleep apnea, and obesity hypoventilation evaluation, and the evaluation of upper gastrointestinal anatomy and psychological evaluation. In module 4, we'll be discussing on the basics of bariatric surgery. What is bariatric surgery? Types of bariatric surgery includes 4 types. They are sleeve gastrectomy, gastric bypass, biliopancreatic diversion, or duodenal switch, and gastric banding. And what are the health benefits of bariatric surgery? And what are the potential risks of bariatric surgery? And what are the estimates of bariatric surgery benefits? In module 5, here we'll be knowing how to assess the patient before the bariatric surgery. The perioperative nutrition assessment, education, and counseling. Nutrition care process during the perioperative period, and preoperative nutrition education and counseling, integrating education and counseling with the nutrition care process, and the potential preoperative micronutrient deficiencies, general nutrition guidelines following bariatric and metabolic surgery. And what are the macronutrient recommendations needed before the bariatric surgery? We'll be discussing in the module 6. Here, we'll be discussing each macronutrient, including protein, carbohydrate, and fat, in which we'll know what are the requirements of each macronutrient and the role of each macronutrient, and what are the basic needs before the bariatric surgery. And the recommended micronutrient supplementation we'll be discussing in detail for the patients who are undergoing bariatric surgery. In module 7, we'll be discussing on the management of nutritional complications. We'll be discussing it as part 1 and part 2. In part 1, we'll be discussing about the management of gastrointestinal intolerance, which includes vomiting, loss of appetite, dehydration, and electrolyte abnormalities. And second one is management of neurological complications, in which we'll be discussing the role of thiamine, vitamin B12, and copper. And in the management of nutritional anemias, we'll be discussing on the micronutrients, including iron, vitamin B12, and folic acid, copper, vitamin A, and selenium. And in part 2 of the management of nutritional complications, we'll discuss on management of bowel changes, including diarrhea and constipation, in the management of protein malnutrition, which includes the loss of lean body mass and hair. And in the management of dumping syndromes, we'll discuss both the early and late dumping syndromes, management of metabolic bone disease, and the management of ocular complications. Majorly, we'll be discussing on the micronutrient vitamin A, and the management of compliance and behavioral issues that includes maladaptive and disordered eating. And the nutrition care process across the weight loss surgery throughout the weight loss surgery process, what are the nutrition care that the patient needs? Here we'll be discussing it as part 1 and part 2. In part 1, we'll be preparing the patient physiologically for the surgery. That includes the nutrition intervention strategy, the importance of medical nutrition therapy, protein, and the energy or very low calorie diets. And then we'll prepare the patient for the lifestyle changes. How much weight can I expect to lose? Will I gain my weight back, or will I need to exercise? These are all patient basically will ask. After the surgery, will I have to do all these again to maintain my weight or what? They'll definitely have these questions. So we'll be discussing on these again. What behavioral changes will I need to take? And the third part will be healing from the nutrition to recover from surgery. It includes the main nutritional goals and the dietary strategies, that is food tolerance and the physical activity. And in part 2, we'll be discussing on the achievement of the bariatric surgery. So what on all the patient can achieve after the bariatric surgery, we'll be discussing in this module, and we'll be creating the new normal to the patient. This includes a new dietary lifestyle, AHA recommendations for a weight loss surgery patient, and the special modifications of a healthy diet for a post weight loss surgery patients. And then we'll discuss on the maintaining part. In this part, we'll be help the patient to manage the post-surgery weight regain, and this will include identifying the maladaptive behaviors, dietary strategies for managing the weight regain, physical activity strategies for maintaining the weight regain, and we'll be concluding the entire modules. So I hope you all had a good idea of the course contents of this certificate course on bariatric nutrition and health. And the certificate course will definitely equip you to guide the patients pre and post operative in the bariatric surgery. And it will also add another aspect to your practice of nutrition and dietetics. So we'll be meeting again during the course session. Thank you.